GLP-1s versus Metformin. New study reveals reduced dementia risk. Imagine a world where a simple medication could reduce your risk of dementia. Recent studies suggest that's exactly what GLP-1 receptor agonists might do for people with type 2 diabetes. But here's where it gets controversial. This new research might be shifting the way we think about treating diabetes and dementia. A groundbreaking study published in BMJ Open Diabetes Research Care offers the first direct comparison between GLP-1 receptor agonists and metformin, the standard first-line treatment for type 2 diabetes. This study analyzed the electronic health records of over 174,000 patients across nearly 2 decades. The findings? GLP-1 receptor agonists may offer a 10% lower risk of all-cause dementia compared to metformin. That's a significant number, especially when we consider the 45% of dementia cases linked to type 2 diabetes. But what's the catch? Well, the benefits seem to be more pronounced in older adults, women, and certain racial subgroups. And while GLP-1s showed lower all-cause mortality, this could also mean that patients simply have more time to develop cognitive symptoms. The mechanism behind GLP-1s is fascinating. These drugs can cross the blood-brain barrier and potentially reduce neuroinflammation, improve insulin signaling, and alter amyloid and tau pathology, which are hallmarks of Alzheimer's disease. However, some researchers caution that the findings may be influenced by socioeconomic factors. For instance, GLP-1 drugs are more expensive and may not be as widely available in public healthcare systems, suggesting that the patients who take them might have other advantages that contribute to better outcomes. Additionally, the study did not provide detailed information about the patient's characteristics before or after statistical matching, which leaves some room for uncertainty. As we consider the implications of these findings, one thing is clear. We need more long-term studies to validate these results. But the potential for GLP-1 receptor agonists to be first-line therapies for type 2 diabetes management is intriguing. It could represent a paradigm shift in preventing cognitive complications of diabetes. So what do you think? Should we be considering GLP-1s as a primary treatment option for type 2 diabetes? Or are there other factors we need to consider? Let's discuss in the comments. References. Full study link. Ozempic. The surprising brain benefit you need to know. A groundbreaking revelation has emerged from the scientific community, suggesting that a commonly prescribed medication could offer an unexpected shield for your brain. Prepare to be intrigued as we delve into the latest findings on how Ozempic, a drug primarily used for type 2 diabetes and obesity, might also reduce the risk of stroke and improve recovery outcomes. But here's where it gets controversial. Could this discovery redefine our approach to stroke prevention and treatment? And this is the part most people miss: the intricate mechanisms behind this potential neuroprotective effect. At the Society of NeuroInterventional Surgery's SNIS 22nd annual meeting, 3 studies were unveiled, exploring the potential of GLP-1 inhibitors, including Ozempic, to mitigate stroke risk and limit brain damage. These medications, known for their ability to lower blood sugar and promote weight loss, are now showing promise in a new arena. Let's unpack the details of these studies, which could spark a heated debate among medical professionals and the public alike. Study 1. Ozempic's impact on stroke survival. The first study, titled Semaglutide Ozempic and Stroke Survival, a comprehensive analysis, led by the University of Wisconsin-Madison, analyzed data from a global health database and their own medical center. The researchers aimed to determine if Ozempic users had better survival rates after suffering from acute ischemic strokes. In the global dataset, which included over 2 million stroke patients, 43,338 were also taking Ozempic. The university's dataset comprised 13,510 stroke cases, with 190 patients using Ozempic. The results were striking. Ozempic users had a significantly lower risk of dying from stroke-related causes compared to non-users. In the global dataset, the initial mortality rate for Ozempic users was 5.26%, versus 21. Long-term survival rates were also higher for Ozempic users, 77.5% compared to non-users, 30.95%. The university cohort echoed these findings, with 5.26% of Ozempic users dying from stroke, compared to 26.57% of non-users. Study 2, Ozempic and Stroke Risk Reduction. The second study, Ozempic and Stroke Risk, an Emergency Department Perspective, also from the University of Wisconsin-Madison, analyzed emergency department records to assess the relationship between Ozempic use and stroke risk. The researchers found that potential Ozempic users had significantly reduced odds of experiencing a stroke. This finding suggests a potential protective effect of Ozempic against stroke, although further research using pharmacy data could provide more precise insights into this correlation. Study 3. GLP-1 agonists and brain hemorrhage outcomes. The third study, GLP-1 agonists, a new hope for brain hemorrhage and stroke outcomes, presented by the University of Texas Medical Branch, investigated the impact of GLP-1 inhibitors on patient outcomes after brain hemorrhages and strokes. The researchers reviewed patient records and found that GLP-1 inhibitor use was associated with a reduced risk of cognitive side effects, seizures, future brain hemorrhage, and death. This study adds to the growing body of evidence suggesting that these medications could play a role in improving outcomes for patients with brain injuries. Dr. Ahmed El-Bayoumi, a research fellow and data scientist at the University of Wisconsin-Madison and lead author of 2 of these studies, expressed enthusiasm about the findings. While more research is needed, the potential neuroprotective benefits of these medications are truly fascinating, he said. Dr. Matthias Costa, from the Neurosurgery Department at the University of Texas Medical Branch, and author of the third study, added, "This research opens up new possibilities for preventing and managing the devastating effects of stroke and related brain injuries." Stay tuned for more updates on this developing story. Subscribe to our newsletter to never miss a breakthrough in science and technology.